As folks are joining, wanted to welcome everyone to this event hosted by Augie and co-hosted really with Brooke Boroff. Wanted to thank you for your time today, Brooke. I speaking on a subject that I know when I was a new mom, I was nervous about, but really didn't feel like I had any information about, and therefore might have also been nervous for no reason. But it was one of those things in new parenthood where it's like, oh, another thing that you have to be worried about. So Brooke is the founder and owner of Infant Insights, and she's here to talk about flat head syndrome. And I'm excited to learn more about it and what I should be thinking about for number two whenever that happens. But for those who are on the call, feel free to put questions in the chat. I'll monitor those. And then at the end of the call, we can bring those up for a Q&A session, and you'll have a chance to kind of raise your hand and ask questions live as well. So let me go ahead and admit everyone. All right, so everyone should be in, and I'm going to hand it over to Brooke.
Okay. Oh my goodness. I don't know if any of us have talked on Instagram or met, but I am so excited to talk about flathead. I mean, that is one thing that my husband probably gets annoyed with me because I talk about it too much, but I'm so excited just to educate really and empower you guys. So I'm going to share my screen, just kind of go through a PowerPoint. I can try to make sure I can see the chat, but if we could try to make sure the questions are at the end, that would kind of probably make it easier as we kind of go through the presentation. So I don't miss anything. I don't want to miss anything that you guys have questions about. So let me get this PowerPoint up, and that, can you see it all? Everybody's good to go? Y'all can see the screen? Okay,
Looks
cool.
good.
So this is my son actually, and I'm going to tell you a little bit about him. Uh-oh. Oh, hang on. Sorry, y'all. I'm so sorry. I don't know how that happened. Let me come back to my Chrome. Well, sorry, ladies. This is not the first time I've shared my screen before, but it seems like it is. Okay, one more time. Okay, so this is my son, and that's kind of how I got started in Flathead, is kind of dealing with this as a first-time mom. So excited to tell y'all a little bit about me and how I can help. This is the order of the conversation. You're going to learn a ton. Okay, so we're going to learn about what is Flathead, how does it happen, how can I make sure that it doesn't happen to my baby, but also if it has happened and your baby does currently have a flat spot, how can I kind of work through that without maybe needing a helmet later? Okay. So excited to talk about that. I'm Brooke. Like we said, I'm an occupational therapist. So professionally, I definitely can speak about topics like this, right? But I'm also a mom, and I really take that role very seriously. And that's why I want to help other moms. So, how I got started was my firstborn. I had worked with kids most of my career, but when I became a mom myself, it changed everything, right? So my firstborn, I brought him home. They of course told me to put him on his back. His name is James. He actually is 3 years old now, so been working with moms and babies for quite some time after becoming a mom myself. But they told me, put him on his back to sleep, and I quickly realized that he really liked to turn his head to the left. Okay, so I'm like, all right, they told me to put him on his back, so I have to put him on his back, but also he really likes to turn this side, and I'm not quite sure. I'll try to give it on the right, but he just turns it back. So just feeling as a new mom a little bit lost as far as this goes. So basically at 2 months old, I noticed that his head was flat and went to the pediatrician, and she just told me to kind of, here's a handout with stretches, which I was already doing because I'm a therapist, so I knew about that. But also just keep him off the head was kind of what she told me. Keep him off the head. So I did that for 2 months. And at 4 months old, she basically said, Brooke, his head is not better. And so we're going to have to think about a helmet, if by 6 months it's not better. So basically she just said wait and see, and I am not a fan of that. Okay, not a fan, especially when it comes to head shape, to wait and see. So I put my therapist cap on, and I started to plunder through research, how does flathead happen? How do helmets work? And essentially, I developed a program that rounds head shapes without a helmet. So between our 4-month appointment and our 6-month appointment, you can tell here in this photo, my son's head was basically rated mild to moderate, but you can tell it's like pretty wide here, which indicates back flattening. And also the left side is more flat because he preferred that. So if you see on this shape, it's much more normal. And of course, thankfully, I was able to avoid a helmet, but also thankful that that is there if I did need it later down the road, right? So basically, at Infant Insights, everybody who consults with Infant Insights and works with parents like you guys, we're parents too, right? So we really, really care about you, and we just want to make sure that you feel confident and you feel empowered and educated. So in the workshop, it's going to be about 30 minutes probably, but we're going to just talk about flathead. We're going to talk about how to prevent flathead, and then we're going to talk about how to correct it too. So I'm so excited. Let's like nerd out on flathead, okay? So basically, flathead originated when the Back to Sleep campaign started. Okay, so flattening of the head existed before this, but really helmets were not a big thing because babies were typically sleeping on their sides or their belly, which a lot of us probably did. Because we're kind of getting to like, now we can see like trends and things. So as SIDS went down, which is the reason why Back to Sleep kind of was placed, then flathead syndrome increased. Okay. Because think about it. Now babies are sleeping on their backs more. The soft skull is very soft. And so now, of course, some asymmetries and some abnormalities are happening. Okay. So this is the normal head shape. If you look at this head shape, if you divide the head into 4 quadrants, okay, make a little X, you see it's not super wide at the level of the ears, and both the sides look pretty good, okay? They look equal. Some flattening is normal, but you can't really tell, okay? So different types of head shape that kind of we see are, this is called scaphocephaly. This is plagiocephaly, which is side flattening. And then we also have back flattening, okay, or brachycephaly. So scaphocephaly is essential because you're like, okay, I'll just keep my baby on their sides all the time. But actually, some midline pressure is important because if not, we get a really elongated head shape, and that can be abnormal as well. Okay. This one's not as common, but I do see it just as a professional. So the one that I see probably the most is plagiocephaly. So this is one that my son had. So basically, this is going to be present if your baby has a side preference or torticollis, and we're going to talk more about that. Okay, so you may see some ear shift, some forehead shift, things like that with plagiocephaly. The other one we see a lot is brachycephaly, which is back flattening. Okay, so and really, I'm going to talk about how to see this in your own child, but you can literally just take a photo just like this and kind of see if there are any differences in the sides or width at the level of the ears. Okay, so typically brachycephaly is that baby that loves to lay in midline. Maybe they are the only place they'll sleep is like a rock and play or a swing or a dog-a-tot. Totally respectable, but definitely something that we see a lot of babies that sleep kind of that midline position. So, risk factors for flathead, y'all, I always say everyone is at risk because typically these days babies are sleeping on their back and that makes them at risk. But these babies are kind of more at risk that you see here. And we just want to make sure we're paying attention and we're catching it early. Okay, that is like so important. If you learn nothing, I want you to learn how to make sure that your baby's head is round and good, or how to prevent it from the very start. Okay, because it affects 50% of babies. So many parents are dealing with this and no one's really talking about it. So that's why I felt led to share my experience as a mom and a professional because it's not going away. Okay. So let's talk about how we prevent flattening. So this is my second child. She's 18 months now. And thankfully, after my experience with my first child, I kind of knew what to do. So now I can tell you, right? So prevention is all about observing your baby, the positions that they're laying in, and prioritizing things like tummy time, baby wearing, and such. Okay, so the areas that we want to observe are these 6 areas. So, sleeping positions, the car seat is very important. Okay, you will never hear me say like I'm anti something. Like I'm not anti Duna or anti ebb and flow shift, but I am for educating parents on the fact that this can cause flattening. Okay, so totally fine if you use those devices, but you just want to make sure you're rotating your baby's head. Okay, just make sure you're rotating their head, because if they're in a car seat a lot, then it can become flat. Okay, floor time positions, like when you put your little baby on the floor, are they always gravitating towards that right side? How are they when they're held? Do they really focus on one side or the other? Like, is there some asymmetry there in how they kind of move, right? Feeding, a lot of times parents cradle. I did too, cradle in one arm if you're bottle feeding. And so a lot of that pressure on the head can lead to some flattening. And then lastly, container usage. Like I said, I am not anti container, okay? Because I'm a mom. We just got to be practical, right? But we are able to rotate our baby, maybe prop them a little bit, just making sure they're not on the same place of the head all the time, okay? So we just want to keep the scales balanced. I always tell people it's like a pancake, okay? If you're on the griddle and you're cooking a pancake, you want to make sure that pancake doesn't get burnt on one side, right? If it gets burnt on one side, that means maybe it got too much attention. So we want to make sure we keep the scales balanced and we have a beautiful round head. Okay. So we also want to observe. So we want to prioritize positioning. We want to observe our baby's head. We want to observe how they're laying. I recommend taking photos of your child's head after 2 weeks old and every 2 weeks until 4 months. Okay. So at 2 weeks old, start observing it. Every 2 weeks, just snap a photo from the top. And then at 4 months old, you're probably in the clear because their head control is stronger. They're probably sitting up some too. Okay. So observe it, observe it, observe it. I don't want you to be blindsided if you go to the pediatrician and they're like, oh no, Brooke, your baby's head's flat. You can say, hey, I know it's flat. I'm working on it. Okay. Just to kind of empower and educate. So we talked about how often you should look at the head. That's very important, okay? So prioritizing these things to prevent flattening. Tummy time, okay? Tummy time is huge. And if you follow us on Instagram or you have any of our free resources, we really try to educate parents on what's normal in tummy time, how to change up the positions, change up the toys. Tummy time is, I mean, I know y'all hear that all the time, but of course, do the tummy time, okay? Neck stretches, which I'm going to teach you some of those, is very gentle, okay? And one thing I always tell parents that we work with is if you can move your head that way, your baby should be able to move their head that way, okay? So if you can tilt your head to the side, our baby should be able to as well. And those are all we're doing with the stretches, is just checking that range of motion, okay? Baby wearing is great. Love to baby wear. I wasn't able to baby wear as much with my firstborn because of some birth trauma, pelvic floor health, but baby wearing is like a really good way to get them off the head. Okay. You also want to rotate the play position. So I love to tell parents start with tummy time, go into side lying on both sides, end in back play. Okay. So tummy time, side lying, back play is the idea. Milestone acquisition is really important. So making sure your baby is like strong in tummy time. They're working on those rolling skills. Okay. So working on those sitting skills when they're 6 months, getting them off the head. So all of those things are really important to prevent flattening. And then lastly, like I said, limit container usage. Use the container, use the bouncer, use the car seat, use the swing, but try to get them out of that as much as you can during the day. Or, if you're out and about, pop them in the baby wrap as you get to the store instead of keeping them in that stroller the whole time. Okay. Just some things to think about. Stop monitoring it really whenever your baby is 4 months old or so. After that, if the head's not flat, then it's fine. It's not usually going to become flat after 4 months. Okay, so you can relax after that kind of age. So really working on rolling, sitting, and then if they're sleeping on their belly, that's whenever you're kind of out of the woods. So, kind of a good rule of thumb with belly sleep is if your baby can roll themselves there and roll themselves back, then they're fine. Okay. So, of course, ask your pediatrician, but that's when you don't have to worry about the head shape anymore, which is good, which is so nice. Okay. Let's talk about correction though, because I'll tell you, I'm glad that helmets exist. I think helmets are great, but I do think there's a lot we can do before a helmet is warranted. Okay, so let's talk about correction. Correction is all about early detection. Okay, so you really want to make sure that either your pediatrician has told you about it or you have noticed that it is flat. Okay, and we do free assessments at Infant Insights, but take a screenshot of this screen. Make sure you're checking your baby's head at this position, because this is the way that we assess it. Okay, so that's kind of how we see, do we see any elongation, do we see any difference in the sides, do we see any width at the ears? And if we do, you can see this as some babies develop flattening in the womb, so you may even see this in a newborn, a fresh baby. Okay, but at least at 2 weeks old, let's start looking at it so we can make sure to know what to look for. Okay, so the flathead cycle, this is what I call, literally, like, most babies that have flathead enter into this cycle. Okay, so your baby sleeps hopefully well, right? So your baby sleeps in a position, for my son it was to his left. The flattening occurs on that left side. They're using that side of the neck a lot more than the other side, so the neck becomes a little tight, and now the flattening is like a puzzle piece and the neck is tight, and so they're just staying in those positions. Okay, so it's just a cycle, it just keeps on going round and round. So our goal is to break the cycle. All right, so ways to correct flattening, there's several ways. Okay, you can do traditional PT or OT, which I'm an OT. So I am a traditional occupational therapist, but I do specialize in head shape. So if you look at traditional therapy, I really want you to ask that therapist, hey, what experience do you have in plagiocephaly? How many babies do y'all work with that usually end up in helmets, right? Because if they're just teaching you to do tummy time and keep them off the head, we're going to talk about that, but that may not be the most effective treatment. Okay, cranial helmets, of course, they're so cute. Babies that have little helmets are adorable, but they are a lot of work. Like, you have to keep, you have to go back to frequent appointments. Sometimes the baby needs it for 3 months, sometimes they need it for 6 months. So of course that's kind of a more invasive intervention, and we want to try to prevent that if we can. You can also go to an osteopath, which helps with like tension release, adjustments, very similar to a chiropractor. But you want to make sure that the baby is getting head shape focus, not just tension focus. Okay, because we're talking about that. We'll talk about that. But like we said, the flathead cycle is very, it's tension and the head shape. So craniosacral therapy is another way to kind of reduce that tension. They actually do work on the head shape a good bit too, which is nice. They kind of help adjust some of those lower bones in the cervical region, and really help kind of those plates in the skull. And so craniosacral therapy can be very effective too with correction. But what we teach at Infant Insights is repositioning. Okay, so we teach reposition the baby to around the head shape, and we teach stretch the baby actively during the day to resolve the tension so we can break the flathead cycle. Okay, we got to make sure we break the flathead cycle, because if baby starts to sleep in that favored position, we can reposition during the day, we can work on some stretches, and then at night the baby is choosing opposite sides, not on the flattening, and now we're in good shape, right? We're really in good shape. So that's our goal, really. So to make sure that we correct the baby, correct the head shape, we have to analyze our baby. Okay, so looking at those patterns, making sure that the baby is on different areas of the head, not on the flat spot. Okay, so where's the head flat? What positioning is best to make sure that we're rounding the shape? How old is the baby? Is my baby sitting up? Because if my baby's sitting up, then it's going to be a little bit harder, right? How does my baby attend daycare? How often, am I with my baby? How often does my baby sleep at night, during the day? All of these things matter in order to correct the shape. Okay, so it's very important to analyze these things with your baby. And then once you analyze, you can develop a plan. Okay, so another thing we're analyzing is tension. We want to make sure, does my baby have a favored side? Like, is it just the head shape is flat, or do they really, are they kind of stuck in these turns, right? Or does my baby sleep all night with their head straight? And like when I turn their head, they don't really want to turn it, right? That may indicate a little bit of tension. Do they have torticollis? Do they have difficulty with feeding? A lot of babies we see have history of oral ties. So there's breastfeeding issues, bottle refusals, things like that that were linked to oral ties. We may see some tension in the body because oral ties are tension in the oral cavity. Okay. Does my baby arch a lot? Did my baby come out with a lot of head control? Were they born with a lot of head control? A lot of these things indicate tension. And then, of course, does my baby already have flattening? Because if the baby has head flattening, I'm telling you, 9 times out of 10, they have tension. Okay. So, whenever we want to correct the tension, we want to implement a plan. We want to stretch the neck. We want to stretch the body. So, let's go over some neck stretches that you all can just take home and do if you'd like. Feel free to screenshot if you'd like. And we also have free resources at Infant Insights. So, I'll share those at the end. So, the first one is neck extension. Okay. A lot of babies that have back flattening have a little bit of trouble with tummy time, and therefore they have trouble with this position. This kind of freaks people out, but think about it. If I was to take, this is my son, by the way, if I was to take my son and flip him onto his belly, he's lifting his head exactly like tummy time. Okay, so we're just making sure he has the full range for extension, which is really important for tummy time. Okay, the other one is a lateral stretch, so ear to shoulder. So if you can put your ear to your shoulder, like I said, your baby should be able to put their ear to their shoulder. All right. A lot of times, babies that have a little bit of tension have some tension in this upper back, lower neck. Okay. So that trap can get a little tight, and this stretch really helps with that. Okay. I always say stretch both sides because you can kind of see if there's any tension in there. If the sides are equal, there's no tension, right? The other one is rotation. So this is the one you commonly think about when you think about stretching the neck. You rotate, you want to make sure your baby can rotate sides. This kind of addresses that SCM muscle that is very, very important for neck rotation. Okay, so 3 quick stretches that you can do to make sure to prevent flattening and also correct flattening too. Okay, whole body stretches as well, because what we find is the oral tension can contribute to the neck tension. The neck tension can contribute to some shoulder tension, some hip tension. And now we've got a baby that arches a lot, or they're having trouble rolling over because their body is just tight. Okay. So you can always do whole body stretches too. Okay. So basically, our goal at Infant Insights is to make sure the head is round and your baby can move freely. Okay. Because it really is a two-parter. And so we want to make sure we're taking a very holistic and comprehensive approach. Okay. So a little bit about how we're different. So helmet therapy is going to correct the shape. Okay. A traditional therapy, if they're not certified in head shape correction, will typically address the tension. And at Infant Insights, our goal is to teach you to do both. Okay. And what you do at home with your baby is the most important. I mean, you're with your baby more than anyone. So if we can educate you and coach you, then you will know what to do, and your outcomes will be better. Okay. So basically, if you wanted to ever work with us, we would analyze the shape, then we would help you with specifics for your baby, and then you would go ahead and implement our program, and then we support you closely through that program the whole time. Like, we are not people that just say, okay, Brooke, buy our program, bye. No, ma'am. We make sure that you have all the resources that you need. You can send us pictures, all the things. We're here to help with that. So it's very effective, y'all. I've been doing this for about almost 3 years. September will be 3 years. And I mean, it works really good. So I'm like, okay, this is great. And I've helped, probably, these are back flattening babies. So if you see, like, you see that head is like, so let's go back to this slide real fast. So you see like left side flattening, like pretty significant. And then, of course, much more round, very, very not using a helmet, but much more round shape, and very thankful that that mom was able to implement our program. And then you see here, same left flattening, and then now much more symmetrical. Okay. And then these are back flattening. So some back flattening here. You see the width is pretty wide, and now we're in much better shape. And then here, of course, width significance here for back flattening, and then much more narrow. Okay. So, I mean, we've helped, this says 1,000 plant parents. I should have updated this the other day. I mean, I think now we probably helped about 2,500 parents. So, I mean, a lot of babies are being helped, and a lot of parents are feeling encouraged, and that's just our goal. Like, so many parents are like, Brooke, my baby's head didn't become flat because I knew, I followed you on Instagram and you taught me. Or so many parents say, hey, Brooke, like, my baby didn't need a helmet. They thought he would and he didn't because we did your program. And that's like, that gives me life. Like, I get so excited about that. So our program is backed by research. So we make sure, I follow research very, very closely. And essentially, our program at longitudinal studies is equally as effective as any other treatment, like helmets and things like that. So that's positive too. So anybody benefits from our program: babies that have side or back flattening, babies that are not crawling. So if your baby is crawling, you can still reach out to me and I'll kind of give you some tips, but typically they're much harder to position. And then if you want to correct your baby or prevent your baby's flattening, that is kind of who we serve. And you also, always want to support milestones at any time too. So that's kind of what our program does. So basically, really fast, we want to see an improvement in head shape in 4 weeks. We want to make sure we have improved movement. We want to make sure you feel confident, you have less anxiety. Like, that is our goal, because there's just a lot of waiting and seeing at times, and we are not trying to do that. We're trying to get on top of it and move on, because I want you to enjoy your baby. Like, these baby years are so quick to pass us by, right? So essentially, if you want to see if our program works for you, I'm going to drop a link in the chat. I'm very I don't want people to just feel like, I don't want them to feel like, okay, I'm not sure if this is going to work for me, right? So we really like to take our time and make sure that it works for you and your family. So I'm going to put the link here. If you'd like to book a free call with us, I'll also make sure that it's sent after the recording is sent to you guys. So you can always just have that link anytime. Okay. So yeah, that's it. That's all about flathead. I could literally talk for a long time, so I'll stop it there. But hopefully, y'all learned some good nuggets, and we can go through some of these questions.
Thanks, Brooke. So, a few things that I thought were interesting. One that I really liked that you started off with was that wait and see is not something that parents should be told, and that it's not helpful whatsoever. And I do feel like that's often the advice you get from pediatricians early on. And so it's nice to feel like there could be a partner with you to start taking action and actually start making improvements. Um, Things I never considered: holding them on one side while you're feeding is enough to potentially cause issues. And I'm like, yeah, I know that I always would hold in my left arm because that was just my stronger arm, or being right-handed. So that's food for thought. And taking photos every other week, starting at 2 weeks, I think is a super helpful and actionable tip. So some questions that came up in the chat during the session was, let's say the baby's able to move their head all around, but they're still showing preference for one side. Is stretching still useful?
Yeah, that's a good question. So really, if I just actually saw a baby this morning. So let's just do a little case study, right? So the baby has right flattening, and he can move his head pretty well, but he's still sleeping on the right side at night, which is making that flattening worse. So that tells me there's maybe a strength, there's some weakness in there that we need to strengthen, okay? Because when we turn our head to the side, you see my muscle starts to protrude because I'm using that muscle to turn my head. So if the baby never really turns their head the other way, that other muscle may be weak. So there may not be tightness in the other, there may be weakness in one
Mm.
side. Does that make sense?
Yeah, that's super
Yep.
interesting.
And our program, we really like I just coached the mom this morning about making sure she's strengthening the neck because stretches are not very appropriate for her.
How do you how do you help others in your caring network, whether it's husband, nanny, mom, mother-in-law, daycare, learn how to do the stretches and like make sure that they're actually staying on top of it too?
Yeah, so I'm really particular about who does the stretches. So the person who gets our information, I think should be the one to deliver the stretches, right? So mom, dad, typically, sometimes grandparents, or even like a nanny if the nanny's there, all the time. But with daycare, because we're certified like we're licensed therapists. So with the daycare, I usually, if the baby does go to daycare, I send a medical necessity letter and I basically say, hey, Johnny has left flattening. Our goal is to just make sure Johnny is either on these areas of his head or he's off of the head, right? So I don't really want the daycare to stretch the baby because it's like a game of telephone, right? So mom can do that at home, and then the daycare can just help with the repositioning because it's a two-parter, right?
Yeah. Okay, that's really helpful. Um, Thinking about tummy time, which I never thought about straight or stretching out the neck as well, but that makes a lot of sense. Other things that can help make tummy time engaging if they hate it.
Yeah, I actually just shared on my stories today a light up bar. So I I've seen several babies in person this because we work online and in person. And I've seen several babies in person this week. And I bring this Fisher, or I think it's Baby Einstein light up bar, and they love it. Like the babies are like fascinated by it. So I think there is a little bit of a negative connotation with light up toys, but I think if a baby is struggling with tummy time, we have to utilize something that motivates them to stay in the position, right? Because practice makes perfect. And so I don't want parents to be scared to use light up toys in small kind of increments because that can really help their tummy time tolerance. But also, like getting face to face with your baby is so important. Like your baby loves you. Like they have been with you since conception. You are like your baby is your biggest fan. And so making sure you're getting face to face can really help too.
Okay, and then final question that came up in the chat. What if it doesn't seem like it's corrected by 4 months?
Yeah, so I don't like to leave things up to gamble. Like I don't want to leave it up to chance. Okay? So I really like for parents to implement a repositioning plan like what we provided at the Insights for at least 6 weeks, right? And after 6 weeks, if we see improvements, we're probably in good standing. We're probably like, okay, we're not going to need a helmet because things are trending upward, right? But at 6 weeks, if we're still, I've never worked with a baby that hasn't made progress, but if we're just not in that place where we want to be, we might explore, getting a helmet or something like that. But I think I just think it depends on what you do before 4 months because if you're just keeping them off the head all the time and they're still sleeping on that spot at night, it's not going to improve. It's just the mechanics of it.
Yeah. Yeah, there's so
And
much
it's
more
so,
that goes into it.
yes, and it's so I mean, so thankful I like can do this now because I'm like, oh, I feel like we just are told wrong a lot of times. Like
Yes.
there's no amount of time you can keep your baby off the head to improve it if they still sleep on that spot at night.
Yeah. No, that's probably true of a lot of behaviors.
Yes, I know. Like you just have to keep the scales balanced or rebalance the scales, really.
Yeah. Well, those were the questions that came up in the chat. I don't know if anyone has live questions that you want to come off mute and ask, feel free to.
Yes, I would
As a
love to talk to y'all.
reminder, this session will be recorded and sent out afterwards. And we'll share Brooke's information as well, so you have that. All right. Well, maybe that's the questions that have surfaced as of now. Brooke, thanks for your time. This was really illuminating and just really actionable advice, which I think is often hard to get, especially for infants. So thanks.
Yes, absolutely. Y'all please feel free to reach out to us. Infant Insights is kind of our handle, and we have a website, Infant Insights. But we just really care about parents and babies. Like I definitely have found my calling. So I'm glad that I could educate you guys.
Well, great. All right. Well, I hope everyone has a good rest of your Friday and a great weekend.